it's a excellence which both these partnerships together has brought in into the field of, I'll say, governance of health, and created new service standards, and how the government schemes should ideally be processed and working together. So if you see, the health sector has been having just a second. Go with this only. Yeah, is my screen visible, sir?
It is visible
Hello.
now.
Yeah, it's visible. Okay. So if you see, the health sector has been having multiple, what I'll say, challenges which have been there in almost all the states, and I'll say even globally, which has been observed across the nation too in India. And one of the most important has been the medical inflation, wherein the escalation in the cost of healthcare has been making getting the healthcare beyond the reach of common people. Generally, that is the reason why you will see that it's most of the quacks that the general common public have been resorting to as the first line of treatment, because it's easier to get treatment from them at a cheaper cost, while the doctors are a bit costlier, and then going to the hospitals is much more costlier. Additionally, the public hospitals have been limited, and the services which have been there, which were observed to be there in the public hospitals, were also limited, with limited infrastructure in place. And so the needy had no option but to be left at the mercy of whatever they could get anywhere. We had started, India had started the scheme of Rashtriya Swasthya Bima Yojana, so that it could alleviate the healthcare problems, which was a good step in the right direction, I would say. But then again, it was not able to address the critical care illnesses. It was mostly targeting the primary and the secondary care. And it's the critical care which was, I'll say, indebting the population much more as compared to the secondary care. And that is why it could not fill up the vacuum which was there. The government initiatives, whatever the government was taking, even in Gujarat or maybe rest of the country, were not getting the complete support of the private healthcare providers. And that is where the state of Gujarat made a difference when this scheme Mukhyamantri Amrutam was launched. Additionally, you will see that the health services delivery has been very vertical in nature by the government side. Through the, I'll say, the medical colleges, then you have the district hospitals, then you have the regional centers, and then you have the primary healthcare centers, and then you have the sub centers at the village level. So it was not very sectoral or segmented, and specialized care was not being made available. And a comprehensive strategy to address primary, secondary, and tertiary together was something which was missing. So based on these challenges, it was decided that we should come across with a new scheme which would help take care of all these challenges. And that is where the Mukhyamantri Amrutam was born. And then it was, what I'll say, additionally expanded further into Mukhyamantri Amrutam Vatsalya Yojana. So the objective was very specific. First was to give the access to the quality critical care or even the tertiary medical care to the general population. They had to ensure that whatever are the life-threatening ailments, they were being provided treatment to all the population, and to ensure that both the private and the government hospital facilities were available, and that too at a completely zero cost to the persons. So with these three objectives, the scheme was formulated, and then slowly the population was identified. Initially, we started off as a scheme with covering only the BPL population. So that is where the Ma Yojana or the Mukhyamantri Amrutam Yojana was there. But as the scheme progressed in the last financial year also, we kept on adding more beneficiaries. And today you will see that 86% of the population is completely covered in this health scheme of the state of Gujarat. Most importantly, it is run on a assurance mode, and there's no insurance mode. Insurance mode is restricted only to the prime minister scheme, the PMJY scheme, which is covering only the subset of the population. Today, all the families having income up to 4 lakhs are already covered under the scheme. Urban, rural, ASHA workers are covered. All the reporters are covered. Employees in class 3, class 4 of the state government are also covered by us in the scheme. We have covered even the senior citizens of families, even if the family income is up to 6 lakhs. So overall, out of 112 lakh families that were available in the state of Gujarat as per the last census data, we already have covered around 96.63 lakh. 86% population coverage is one of the highest in across any state, considering that even the non-BPL population is covered here. I'm talking about only the non-BPL population as well. In this particular scheme, all the 27 specialties are covered. This was a scheme which was way far much higher coverage being given, much more even than the national scheme. It around 1807 procedures already covered. The sum insurance being given by the state was one of the highest in the nation, with 5 lakh family floater cover. Additionally, this was one of the first schemes to have started covering even kidney transplants, liver transplants, pancreas transplants, which were being done. Knee and hip replacements, which were generally very rare to be covered under any government schemes, were also one of the first to be covered under this scheme. And not only were they limited to government hospitals, but even the private hospitals were allowed to do these knee and hip replacements, which ensured that whatever is the need care requirement of the population has been covered under one of and only one scheme. Few of the features which we have over the years expanded on this scheme include: first is this is a completely state funded scheme. There is no assistance from the national government for this population subset which is being covered under the scheme. It's not on any insurance modality, so there's no question of any TPA or insurance companies saying you can pay only this much amount, and then issues which come out with claim adjudication, delayed payment, premium not received. So none of those issues are observed in this in our state, because we run this scheme completely on an assurance modality. It's completely cashless. We ensure that the persons who require treatment are not required to pay a single paisa, and that is something which has been one of the prominent features of this scheme. In fact, uh, we ensure that if you have taken any treatment, the population is given minimum 300 rupees, which is more one which was used to be one of the highest as transportation charges to be given to the population across India. So we are the first to have started this much high amount to be given. One of the other unique features is the card that we have is completely QR coded. The Mukhyamantri Amrutam card, or the Mukhyamantri Amrutam Vatsalya Mavi card that we call, it's a completely QR coded card along with the biometrics being taken. And enrollment is not limited to any database that we have developed over the years. We have a continuous enrollment facility available. So even if you have recently shifted to the state of Gujarat and you are following under any of these criteria, then you can simply go to the nearest kiosk which we have at the civic centers, the talukas, or even some prominent hospitals. Establish your identity, establish your beneficiary status, and you get enrolled under the scheme. The number of hospitals which you have in the scheme is again one of the highest in the nation. Already 2522 hospitals, of which 716 are private hospitals, and all the 1806 government hospitals and the sub-centers have been empaneled under the scheme, which are giving treatment to the beneficiaries. Another aspect which was different was here, since there was no insurance company involved, all our payments were directly from the state government, what I say, treasury to the hospitals, and it was an online transfer without any intermediation by anyone. Quality was something which is very much highlighted by us right from the beginning. We have been one of the earliest states to have been giving incentives of 10% over and above the normal rates to any of the accredited hospitals, even if they are accredited by, say, NABH or JCI or ACHS. So all those hospitals have been given incentives, and this has incentivized the hospitals to further improve upon their own qualities. So if you see under the PMJY, the very first gold certified hospital was again from Gujarat itself. So that is how our quality services have been something which we have been promoting over the years, and which has been a unique feature of this scheme. For death cases, ambulances is something which is being provided by us, which is a very unique feature of our scheme. About the scheme administration, it's nearly the same. We have a state nodal cell, and then we have the implementation support agency, wherein MDIndia Health Insurance DPI has been handling almost everything of the scheme right from the beginning. So they do take care of all the empanelment activities, the call centers, the deployment of Arogya Mitras, audits, analytics, IC activities. Feature which MDIndia has been providing is they are not only providing us with the specialist manpower, they are also ensuring that they do state of the art analytics and audits on the database which has been generated over the years. That is why you will find that Gujarat, though, is having one of the highest uptakes, the quantum of what I'll say abuses is very low in the scheme as compared to other states. There are audits, there are analytics which are completely run, they have been technology driven, and that is something which has been making us completely stay away, ahead of the time. Treatment claims processing, it's made very simple by us, wherein the beneficiary simply approaches our network hospital with any of the Arogya desk, the help desk that we have there, wherein the Arogya Mitra, who is an employee of the TPA, assists the person, guides them what is to be done. They swipe the MA card, which is a QR coded card. There is a biometrics verification which is done. Then they go towards for the consultations. The data automatically flows through the software to the ISA end, wherein the specialist doctors who are postgraduate doctors in that specialty for which the patient has been seeking treatment, they go through the documentation, ensure that all the treatments are as per the good clinical practice guidelines, the good medical treatment guidelines, uh, whatever are the standard treatment guidelines which have been developed by our team of doctors. They adhere to all those things, and accordingly it gets authorized. The treatment is initiated. Once the treatment is completed, the payment of the transport charges is done to the patient, and then the patient happily goes back. The claim gets auto submitted within 7 days, and then it gets processed, and then the payment goes back to the hospital in a very completely non paperless environment. Few of the excellence processes that we have been what I'll say keeping us ahead of the time, and even now in times of COVID, have been first and most important has been we had a very dedicated what I'll say detailed understanding what is the need, and we ensure there are periodic reviews which are happening. The TPA, the SNA officials, they meet on a daily basis and on weekly basis. They have detailed reviews of where the scheme is progressing, what is happening, where, and everything is tracked in a very completely transparent manner. We have seen the highest involvement in this scheme, and which has been one of the reasons why this scheme has been most successful in the nation, even from the CM office. Like when the scheme started, and when Shri Narendra Modi ji was very much interested in just getting this scheme off the line, he simply made ensure that the commissioner calls up the private hospitals and simply tells them you just have to sign the documents. That's the kind of initiative which has been happening, being taken from the highest levels, which is very rarely seen generally in other schemes. Even today, the commissioner of health office, the principal health secretary's offices are open for the hospitals. And every Tuesday before the lockdown came in till February end, we used to have the meetings of the private hospitals on a weekly basis on Tuesday, wherein they could simply come with whatever suggestions they have. Very rarely does any hospital has any grievance under this scheme. So they used to come with different suggestions like what procedures could be taken, what rates could be adjusted. The whole infrastructure, the whole scheme is run by medical specialists. We don't have all those are allopathic doctors who are involved in the implementation of this scheme, which has ensured that there is complete faith, understanding, and support of the treating fraternity as well. So there's complete understanding of what good clinical practices would be, and that is why that complete support has been happening at all levels in this particular scheme. Whatever are the new hospitals which are to be audited, we had our own guidelines which were further modified by the NHA, and now we ensure that they are audited accordingly. Medical audit is happening with respect to infrastructure, beneficiary treatment, qualities, and all those aspects. We have QR coded cards. Yeah.
Dr. Sachin, sorry for interruption, but you had 2 minutes, so please
Yeah, two
conclude.
minutes more. Yeah. So
Thank you.
and when it comes to manpower, we have had one of the best manpowers with regular transfers and relocations as well. So this has ensured that there is very little scope for abuses. As far as governance practices are there, I have already covered most of this point, wherein we have had state level leadership support, paperless environment, and transparency and accountability, which has ensured to give us the success. Because of all these things, I'll say the scheme became successful. There has been a huge uptake with around 1555 crores for around 10.55 lakh hospitalizations for the financial year 1920. Almost all registered healthcare providers are now a part of the scheme. Incentives are being given to the government doctors as well who are treating the patient in government facilities, because of which the government setup is improving. There's complete competition within the government and the private hospitals. The package rates that we give to the hospitals in this scheme are completely market driven. And so there is very competitive pricing, continuous enrollment, and as far as the replicability, I think the proof is in the pudding itself, wherein Mr. Narendra Modi ji, when he went back to the center, he has ensured that the scheme gets implemented all across the nation. So this is something which I've been doing, which has ensured that there are smiles all the way. I'll keep the forum open for questions, whichever you would like to address, sir. Thank you very much. Hello.
Hello.
Yeah. Yes, sir.
Yeah, Dr. Sachin, thank you for the presentation. I think we've heard about this scheme in Gujarat and similar schemes in other states also.
Yes, sir.
Recently, I had some reason to visit a local hospital in Delhi. It is a good hospital, but um, it has taken land on lease from the government on subsidized rates. So there is a notice written there that 25% beds have to be reserved. But I could not see any person from the lower strata of the society. So here you have mentioned that all treatment is cashless, and um, the hospitals have to admit the patient. They admit the patient and they provide the best treatment. And public sector is competing with the private sector. So does it mean that uh, the public hospitals which are being overloaded so far will now get the funds to modernize and to provide better healthcare to the patients, because the patients will not stop coming to the public hospitals because the doctors are very experienced.
Okay.
So
So this is exactly what has happened in our scheme here in Gujarat, wherein because of the funding which was being given to the government hospitals, whatever little lacunae were there, they got resolved. The infrastructure uptake happened, and now people are, I'll say, patronizing not only the private hospitals but even the public hospitals. For example, GCRI today has become one of the most sought after treatment center for all the oncology patients, as compared to say whatever are the other facilities provided by Shalbis and Apollos in Gujarat. So this is something which was successful only because of the complete support, and wherein that competitive atmosphere got developed. And the reason was almost all the population is covered under the scheme. The moment you know that you can get something free for free of cost treatment, you do not like to spend out of pocket. And that is what exactly happened in the state of Gujarat, wherein people said कि okay मुझे फ्री में मिल रहा है तो फिर मैं वहीं पे जाऊंगा जहाँ पे बेस्ट हो, और जहां पर बेस्ट होगा वहां पर और बेस्ट होने के लिए तो डॉक्टर्स गॉट द इंसेंटिव्स, क्योंकि आई गेट मोर इंसेंटिव्स इफ आई ट्रीट मोर पेशेंट्स, and for me to get more patients I have to improve on my infrastructure. And whether they're improving not only on infrastructure, even the quality treatment has to improve, and that is where the standard treatment guidelines as a system got implemented in the state of Gujarat. Like today even the national scheme is still not having the tumor board compulsion, but in the state of Gujarat we have a compulsion that anyone who is going for any oncology treatment, that treatment has to be certified by a tumor board. It is very rarely seen even in a private sector today. Anywhere you go today, the tumor board is not deciding what is the treatment to be given to the patient. Be it, whether it should be a what I say chemotherapy treatment, whether it should be a surgical treatment, it should be a radiation treatment. That ideally has to be decided by a tumor board, wherein you have representatives of all these three, along with a radiologist, and they decide what is the treatment plan for the patient. This concept is something which is implemented successfully by us in the state of Gujarat, and that is where that
so
success lies, sir.
so how much time are you expecting that the public hospitals will become as good as private hospitals? Or
So today, if you see Gujarat, the public hospitals are nearly as good as private
okay,
hospitals. I'm just giving one example of GCRI, but you go through any other SVP. SVP today is competing with even Apollos. You have a lower, what I'll say, uptake or bed occupancy in Apollo, both the centers in Gandhinagar and Ahmedabad, as compared to what we have in SVP. And SVP is a center which is completely having today medical documentation. We have a EMR in place in SVP, Sardar Vallabhbhai Patel Hospital. It's a government setup. So that incentivization of the medical fraternity and the administrative staff of that hospital has ensured that they want more patients to come. And patients will come only if they get quality, sir. And if they get that ambience, which today has started happening. Only because you have everything free in Gujarat nearly. It's only those 13-14% of the population today who are still not covered under the scheme. So they ensure that they get some kind of an insurance and then pay out of pocket.
Okay, thank you.
Yes, sir.
Sharma ji might like to ask something.
That's a very good project and very successful program. I just want to add, if we, other pathy of treatment like homeopathy and Ayurveda could also be permitted under your this program, Mukhyamantri Amrutum Yojana. Any thinking on that?
Sir, as of now, what is happening now, it's mostly towards the hospitalization that these schemes are running all over India, including Gujarat. And homeopathy, or I'll say allopathy, is most of the time not having that hospitalization kind of a therapy with STGs in place, the standard treatment guidelines in place. But the moment that comes into practice, I think that too will be covered over a period of time. Like even the commercial health insurance today is not accepting that, except for say the Ayurveda therapy, which is given in a government approved Ayurvedic registered hospital. So India is progressing slowly towards that scenario as well, wherein even the other pathies will be taken up, considered duly, and that will also be taken up. I'll say the Ayushman Bharat, it's not only this PMJY scheme. If you see the structure of Ayushman Bharat, it's completely a structure, pyramidal structure, wherein the base is not this government or the critical care hospitals that we currently see in India. The base is those primary health centers, the wellness centers. And it is there that over a period of time, the other pathies will also get involved. Because these are something which are promoting wellnesses, these are something which are promoting health. And that is where, yes, we are on that path, but maybe a couple of years or 5 years down the line, the results will be seen in those pathies also.
Thank you, Dr. Sir.
Sure, sir.
Sachin, you are wearing a mask. Is it to give a message, or is it because you are in the environment where you have to be protective?
Sir, I'm a very small common person, citizen of India, to give any kind of a message. Basically, I'm working from office, and I think it is instructions right from our Prime Minister himself that we should ensure that in any public place we should have mask on and we should have safe distancing in place. I'm just following the instructions of the government, sir,
No,
which are
fine.
in the interest of my safety as well.
Good. That good. You have to you're following the instructions, but I just wondered whether you were in an environment where you're feeling, some kind of a infection.
No, sir. We are working from office. So we are working from office.
Achha.
So it's better. It's a public environment. So we should ensure that we follow the safety precautions.
Okay. Thank you very much.
Thank you, sir.
Thank you so much, Dr. Sachin. Thank you so much. So we'll have another presentation that is from the Deputy Director, Mental Health, from the organization Department of Health and Family Welfare Services, Government of Karnataka, for the project Excellence in Inspirational Transformation Performance During COVID. Thank you so much.
Thank you very much, sir. Thanks for the Scotch team and to all the juries. I mean, am I audible and visible?
Yeah, you are audible.
Yes.
Okay. Is the screen shared visible, sir?
Yeah, it is visible.
Okay. Thank you so much. So, basically, 1 second. Close my Just close the door. So, I'm Dr. Rajini. I'm a psychiatrist and I'm working as a Deputy Director Mental Health from the Department of Health and Family Welfare, Government of Karnataka. Sir, basically, I will be presenting about the mental health support that we have provided to the COVID-19 in this COVID-19 pandemic. So we are all aware that along with the physical health, mental health is also very, very important. And 10% of the people are estimated to have at least one mental health problem. This is according to the most recent study, that is National Mental Health Survey, which was done across India. And in this pandemic, it is scientifically proved that there is increase of about 20 to 30% of the mental health issues because of the crisis that all of us have been going through. So this is all normal people are going through extraordinary stress because of this pandemic, as we all are aware. So in Health and Family Welfare Department of Karnataka, so we started preparations, to be precise, even before the first case was COVID positive in Karnataka. That was on March 11th. So March 7th itself, we started preparations telling that along with the physical health support, we have to provide mental health support also to the COVID-19 tested positive patients and persons in isolation, quarantine, and then the migrant workers at shelter